On the Medical Watch this afternoon, an alarming rise of a life-threatening condition in pregnant women.
Doctors in Chicago made the discovery, and they are now urging those who are at risk to take action.
We were quite surprised and taken aback.
When Northwestern medicine cardiologist Dr. Sadia Khan and her colleagues crunched the numbers across all age groups, a major find. In the past decade, the rate of gestational diabetes has jumped 30%.
So this wasn't just older women or women who may have delayed pregnancy till later in life. It really was across the board.
The condition is associated with a higher risk of serious complications, even death while carrying a baby or at delivery. Hormones that circulate during pregnancy can cause a spike in glucose. For some women, the levels normalize without causing damage. For others, the increase in blood sugar can lead to short and long-term heart complications.
It can lead to a level of inflammation in the body, and that can contribute to buildup of atherosclerosis or plaque in the vessels, as well as impair the heart function and the squeezing of the heart.
Obesity plays a role, but so might other factors.
We know that the rate of pre-pregnancy obesity in women has increased substantially over this time period. Other factors like stress, lower levels of physical activity, poor quality diet, may also be contributing.
The Northwestern investigators evaluated data from more than 12 million women who delivered their first baby between 2011 and 2019. The deep data dive revealed disparities between specific groups, including Asian Indian women who showed twice the risk of gestational diabetes compared to non-Hispanic white women. And among non-Hispanic Black women,
one of the disparities that we noted was that non-Hispanic Black women had a much higher rate of having pre-gestational diabetes, so chronic diabetes prior to pregnancy, which of course is associated with significant maternal morbidity and mortality.
The study may help explain another public health crisis. While maternal deaths have declined worldwide over the past 30 years, the U.S. has the highest rate of any industrialized nation. Access to care may play a role.
Undiagnosed diabetes, undiagnosed hypertension, these are really important complications that may be contributing to a higher death rate.
Armed with sobering numbers, Dr. Khan says earlier intervention may be necessary. Right now, women are screened for gestational diabetes at 24 weeks. Her message, know your numbers.
What your weight is, what your glucose level is, what your blood pressure is, to avoid these types of complications.
Also on the rise, chronic diabetes. There's been a 20% increase since 2011. Dr. Khan says the pandemic year could push the numbers even higher due to lifestyle changes in exercise, eating, increased stress, things like that, and interrupted or suboptimal health care.
It's been an issue for a lot of people.